Hi everyone, my name is Nat and I'm a senior physio at Bodyset. Today I'll be answering some very common questions about overuse injuries, what they are, how we get them, and most importantly, how do we treat them. Then my colleagues will take you through some exercises to manage some very common overuse injuries. So the first question is, what are overuse or repetitive strain injuries? So unlike acute injuries such as bone fracture or an ankle sprain, those injuries accumulate over time. So it's a repetitive stress that we need to develop that kind of injury. So what happens over time with a repetitive overuse, we're getting excessive stress or micro trauma to an affected tissue. Then we start to develop a bit of a niggle that then in turn turns to something more painful and more debilitating if that's not addressed on time. So common overuse injuries would include Achilles tendinopathies, golfer's elbow, tennis elbow, shin splints, stress fractures. We're seeing quite a lot of those at this particular point as physios because obviously our lifestyle has changed quite a bit and some of us may be running a little bit more often, a little bit too much, or spending extra time in front of a computer, which leads to progressive overuse and increasing pain. So how do we develop those injuries in the first place? So the most common cause is actually training error. So maybe we're doing a little bit too much, a little bit too soon. So for example, now in quarantine, you have a little bit more time on your hands, so you're running quite frequently, much longer distances than you used to. Maybe it's something different in terms of the way you're running. Maybe it's new running shoes, or for example new terrain that you have not tried before. Maybe spending some extra time in front of your computer typing, which can actually lead to overuse, particularly in these tendons in here. So quite a few factors may contribute to that. Sometimes you're wondering, why is it my right leg that's hurting, why is it no left? They seem the same, they look the same. However, very small mechanical change in your body can lead to different stress, which is why it's so important to assess that and look at it as early as possible. So you may have been diagnosed with an overuse injury, or maybe you feel like you may have an overuse injury. So what do we do about this now? So most important thing is to identify why are we here in the first place, what has caused the injury, and it's very likely that your physio will ask you then to modify your activities to offload the tissue that's being injured in the first place. Then it's crucial to actually assess the mechanics of your body and see why exactly this tissue is getting so much strain. So biomechanical assessment is usually essential. And then you're likely to be prescribed some exercises to address the issue as well. So make sure to check out the videos of my colleagues where they'll be taking you through some exercises to manage some very common overuse injuries. Key thing when it comes to overuse injuries is to identify them and actually address them as soon as possible, because with overuse injuries what we know is that the longer we go on without treatment, the harder they become to treat and the more painful they can become. So it's better to address them